The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, welcome to today's webinar on in-depth waste stream analysis. My name is Sasha and I will be your moderator for today. Before we get started, I just wanted to give you a brief overview on what today's webinar is going to entail, as well as a short introduction for our speaker today. Today's webinar will start with a slideshow presentation by our in-house expert, Steve Todisco. He'll be discussing a variety of topics with you, all related to waste streams in healthcare institutions. The webinar will show you how to thoroughly and expediently analyze your own waste streams, as well as provide you with real-life tactics for cost-efficient waste stream management. At the end of this presentation, there will be an open Q&A. We will be accepting questions in two ways. You can tweet us questions at Triumvirate by using the hashtag #WasteStream. If you don't have a Twitter, you can ask a question by typing them into your chat pane on the right where it says Questions. All unanswered questions will be answered and sent out in an email after the presentation. In addition to the questions, all attendees will receive a recording of the presentation and a copy of the deck used. Today's speaker, Steve Todisco, is the Corporate Director of Healthcare at Triumvirate Environmental. He has 12 years of experience in the environmental services field and specializes in solutions for healthcare organizations. Steve is responsible for the design and oversight of Triumvirate's pharmaceutical, sustainability, and regulated medical waste initiatives developed to identify and resolve compliance management inefficiencies. Steve has spoken on many topics, including healthcare facility inspections and hazardous waste compliance, and is a Certified Healthcare Environmental Manager and Certified Hazardous Materials Manager. And with that, I'm going to turn it over to you, Steve.
Hello, everybody. Good afternoon. Like Sasha said, my name is Steve Todisco. I've spent the last 12 years here at Triumvirate Environmental. I spent a lot of time in healthcare. It's part of what I love to do. Sometimes it makes me feel a little bit crazy being all in the healthcare environment, but it's really a great environment to be in when we're talking about waste and waste management. What I'd like to do today is spend some time on a couple of different topics, all with sort of a key message in mind. And I'd really like to make sure that we portray this as a common theme throughout the entire presentation, and that being with the key and right methodology, education and resources, any hospital really can improve its waste management plan where the annual savings really can pay for one of itself out of every 4 years. So if you think about that in real terms, that data is based on several best-in-class organizations and sort of their quest to drive down cost through sustainable practices and development of their right resources. So building a plan, developing a strategy as a key message today is, if I could have everybody keep that in mind, that'd be fantastic. As we go through, just as an overview, we're going to be spending some time on 4 of the major regulated waste streams: hazardous, universal waste, pharmaceutical waste, and medical waste. And things we won't be including today that you'll see on your pie chart are solid waste or municipal solid waste and recycling, 2 of the other components that make up the vast majority of the waste that healthcare generates. So you might be asking yourself, why spend all this time on the smaller percentages of waste generating? All these waste streams combined that we're going to be talking about today make up roughly 1/3 of the total waste volume that leaves healthcare. But the reality is they make up the largest percentage of healthcare violations and fines and total dollars spent. So the bigger the headaches for you guys, the more the safety violations. That's why we're spending some time on these specific waste streams today. We'll also spend some time discussing the regulators, who they are, what their focus has been, and some of the key components to make sure that we can all pass with flying colors any of those inspections that they come and inspect your facilities for. So just generally, who is this education component for? It can be valuable on all levels for different reasons, several of which we believe are critical to developing best-in-class institutions. But when you think about who this training and education component might be for, it really is focusing on simple, safe, and compliant programs which we see, from all levels of healthcare waste generation, whether that be laboratory staff or facilities personnel, pharmacy, nursing, senior leadership directors, all of them. They trail over into building cost-effective programs that are pretty reliable on sustainable practices and programs so that we can avoid citations and public relation nightmares when it comes to development of our programs throughout the healthcare sector. Before we begin, I'd like to, you should now be seeing on a screen in front of you just a quick 1 to 5 scale with a question. That question being, how confident are you with the compliance with your waste programs? Sasha is going to go ahead and put up a survey. If you guys could go ahead and fill out this 1 to 5 scale just for us to get an idea of where the audience feels in relationship to their confidence level for their waste programs. While we're waiting for the poll to sort of commence and then get to the results, we typically find that a lot of answers to this, most people feel that they're fairly confident. As comparison, you know, some of the confusion related to simply what folks may not know is on the other scale of the fence, where they don't feel confident with some of their programs. It's specifically related to some of the things that they don't know. So as we get close to sort of finishing up the polling, give it another couple of seconds here for people to answer. Okay. Sasha, if you can see those results, would you share them with us?
Sure. It looks like most people were somewhere between the 3 and the 4 range.
Okay, that's typically not all that uncommon. We spend a lot of time in that area. Thank you very much for your feedback, and it gives me a great sort of heads up as to where people are as a result of their program. So a little bit more on what you'll learn today. Who are the regulators that are focusing on you? Healthcare is, you know, really one of the most regulated agencies in the country, and if not the world. We believe that a few of the things you'll learn today are very specific to the waste streams that we're going to cover. So we're going to cover the hazardous waste, the pharmaceutical waste, the universal waste, and the medical waste streams, and then ultimately where your opportunities could be within one of those 4 streams to both increase compliance, build simplicity into your programs, and drive costs down as a part of building a best-in-class program. Some of the organizations at 30,000 feet that we're interested in paying attention to they fall into 3 specific levels: the federal level, the state level, and the local level. A good example here in Massachusetts of a local institution is the Massachusetts Water Resources Authority, and it directly compares to both the state Mass Department of Environmental Protection and the federal EPA. They have 3 different requirements for the same standards, and the MWRA, being the most stringent, is what you're required to follow here in Massachusetts if you fall in the Massachusetts Water Resources Authority district. With all of those 4 waste streams that we're focusing on today, there are all, both local and state institutions as well as federal, making sure that the federal regulations, you know, are in place in the event that a state or a local authority doesn't have those. In healthcare, sometimes we think of these as the authority having jurisdiction, or the AHJ. Of one of those, you know, 43 agencies. Could be the fire department, could be the state emergency response committee. But here are a few, and some of the ones we'll spend most of our time on today. Focus on the Environmental Protection Agency, OSHA, the Joint Commission, and your state agencies. There's several states represented here today, so we'll try to cover some of them from everybody. And on the medical waste side, because it's primarily a state-by-state driven program, the Department of Health or the Health and Human Services departments for each state. We've seen a lot of questions come to us from clients and prospects alike, asking questions like, where are the regulators focusing their time? We work with over 400 institutions within our geographic reach, and what we hear is up on this slide now. Pharmaceutical waste management is still huge after almost 10 years of managing pharmaceutical waste. It's still a huge focus, and it sort of falls in line with some of these other focus requirements, with the improper drain disposal of pharmaceutical waste and laboratory chemicals as well, or not collecting that material at all, missing the boat when it comes to specific items that need to be collected. Another huge piece of the pie nowadays that the regulators are spending their time on are increasing the focus of that recycling and reducing waste across the board. And with some recent narcotics updates through the Department of through the DEA, there are some additional components that you can and can't do with your narcotics collection. So regulator focus has been pretty specific in healthcare over the last several years, and pharmaceutical waste management being one that's right up to the top. In particular, specific to increasing recycling rates and waste reduction, the United States and China actually just signed a new agreement to reduce carbon pollution faster. And this falls right in line with our waste reduction processes. The less waste we generate, the less pollutions, the less air emissions that we end up generating as well. And the U.S. goal is a reduction of 26 to 28% below 2005 levels by 2025. Now, I've been in this industry for 12 years, and 2025 seems like a long way away, but we're only 10 years from that. It's pretty exciting that all this stuff is happening very, very quickly. China's goal is the same result by 2030, a little bit farther out. Two of the largest producers of waste in the world, and they make up about a third of the world's carbon pollution. As we talk about some of these opportunities related to these waste streams, I want you to think about something very specific. Most of the top institutions that we see track at 25% below what other hospitals generate for waste. So where does all of this lead us? It leads us to say that best-in-class hospitals combine the regulatory knowledge with best practices to achieve significant savings through three things. And these three things are things that I believe wholeheartedly. One is a commitment, and when I say commitment, I mean a commitment from senior or institutional leadership. Two, a plan that incorporates a very specific strategy, whether that's a waste stream specific strategy, or whether that's something that crosses all waste streams. Having a plan is critical to making sure your opportunities are most successful. And then ultimately a long-range target, something that's measurable, something that's attainable. Throughout the presentation, you'll hear all the mechanisms related to tracking and trending, which is becoming more and more prevalent every day. So basically, we believe that most healthcare institutions can pay for about 1 out of every 4 years by building a more efficient program. As we get into sort of our waste stream spotlight, the first waste stream that we're going to talk about is hazardous waste. Now, we talked a little bit about it in the beginning, where one of the smallest but major waste streams, hazardous waste, is by volume, but the largest in cost, sort of by waste stream and by percentage. It's also the largest in citations and fines, and also the largest in headaches, where we would rather spend less of our time. And there are several areas in which we should focus on to spend our valuable time. One of those areas is the laboratory. The laboratory is one of the major waste players, and part of the largest waste generators that they have are solvents. There are several departments listed in front of you. Histology is one of those departments that if you have a laboratory, you'll generate quite a bit of waste. Several key streams that folks tend to miss in this area include the waste from hand staining procedures. We see a lot of methanol-based items or ignitable items as a part of the hand staining process. Regulators look for the purple sink that I'm sure most of you know exactly what I'm talking about. The key is to collect those items if and when they meet the definition of ignitability. We see a lot of thin prep vials or shore path vials. These are trade name items that are developed specifically from cytology, and they have a human component to them inside of them, and a lot of people believe that they're medical waste. They're actually not. The tissue is fixed for its intended purpose, and ultimately it's no longer infectious, but the liquid that material is in is methanol. Methanol being an ignitable hazardous component, and when decided to throw away, becomes a hazardous waste. It gets a D001 code for ignitability, and should be disposed of via hazardous waste and not medical waste. We see typically a lot of decalcifying solutions, things that are acids, both organic and inorganic acids. A lot of that material is specifically used to decalcify bone, and that material is corrosive. The corrosivity components are on a very specific scale, the pH scale. Anything less than 2 or greater than 12.5, you get a corrosive hazardous waste stream. So ultimately, if it's fallen in between, that material could be non-hazardous and avoid collection. We talked a lot about alcohols in the laboratory environment. There are some folks that collect all of their alcohols, and some that, for one reason or another, believe that it's okay to dump their alcohols down the drain. Some of them even have very specific letters from their local POTW, publicly owned treatment works. It's because the POTW enjoys the solvents for the good bacteria, kills off the bad bacteria, and provides a nutrient source for the good bacteria. This is in stark contrast to what the EPA believes. So if you have an ignitable solution, whatever it is, if it meets the definition of ignitability being a flash point of less than 140 degrees Fahrenheit, that material is required to be collected and not drain disposed. So you're actually chemically treating with a waste without a permit in the event that that material makes its way down the drain. In chemistry, you'll see a lot less waste generated. For those of you who have chemistry departments, what you're concerned with in these chemistry departments are the clinical analyzing machines. A lot of them will have a very, very high concentration of water as a drain discharge direct to your drain disposal. And 99+% of the time, that's completely fine. What the regulators are most concerned with is making sure that you've done your due diligence to understand that a waste characterization has been made on that particular material, and that you update that either when things change or on a yearly basis. So that when the regulators come in, you have all the proof in the world to say, we've done our due diligence, here's our waste characterization, this waste stream is allowed to go down the drain. As we move from the laboratory into sort of facilities or engineering or buildings and grounds, depending on what your organization calls them, we're looking at all the shops, the paint shop, the carpentry shop, plumbing, electrical, so on and so forth. Everyone has these departments, and every one of them generate hazardous waste, some larger than others. The easy area for regulators to find issues is facilities and engineering. It's usually down in the bowels of our institutions, the section of the buildings where there are no windows, and some of the waste streams that we see most often cited are in the paint department. Now, most of your paint shop actual material is either latex or enamel at this point, and no longer an ignitable-based paint or an oil-based paint. But the reality is painters wash their brushes in ignitable solvents, whether that be a turpentine or a paint thinner type material or an acetone, and a lot of the stuff gets washed in a sink. So if you end up drain disposing the material that you're washing your brushes in, it's prime real estate for regulators to come and identify material that's being drain disposed that shouldn't be. That's a big one. Lead-based solder for some older piping and older buildings. We still see a lot of lead-based solder. If you're getting rid of any material piping, then you want to make sure that you either have or you don't have lead-based solder so that you can dispose of it appropriately. And then we see a lot of inherently waste-like chemicals in facilities and engineering in the boiler plant. These are chemicals that are out of date, old containers in a dark corner, darkly lit spaces. Regulators have the ability to say that's inherently waste-like, it shouldn't be there, it's not labeled appropriately, and ultimately cite you for it. So something to think about when you purchase material, so an opportunity to spend a little bit less money on the purchasing side of the house. We see a lot of OSHA violations coming of this area, so machine guarding, lockout, tagout, and exposure risks, because they're areas of the institution that are visited a little bit less frequently and have the opportunity to be areas where there's very few people involved 24 hours a day. Moving on from facilities and engineering and into research, if you do have research, typically we see two types of research. We see both clinical and non-clinical, and here's where you're going to generate a whole slew of different waste streams. Individual bottles, old outdated chemicals. Your satellite accumulation areas are going to look a little bit different in your research areas. These are typically bins that collect waste bottles with labels on them. Some of the things to think about are very specifically, does my waste meet a particular characteristic? Is it ignitable, corrosive? Is it toxic? Is it reactive? And again, from an ignitability standpoint, we're focusing on things that have a flash point less than 140 degrees Fahrenheit under RCRA. Corrosivity, we spent a minute on, less than 2 or greater than 12.5 on the pH scale. From a toxicity component, there are quite a few: arsenic, barium, cadmium, chromium, lead, mercury, selenium, and silver. Those are the RCRA 8 metals, and there are 43 total delisted toxics that are regulated under RCRA. And last but not least, reactive. Believe it or not, this isn't always the things that go boom and explode. This can be things that generate heat when they come in contact with water, things that generate heat when they come in contact with air, when friction is composed. So very specifically, it doesn't have to explode to be considered reactive. and you could end up with something that is a reactive material on your list. And then we see the listed items, the U-listed and the P-listed items, more commonly known of related to pharmaceutical waste in healthcare. But we see quite a bit of virgin product that could meet the U and P listing in research. And just quickly, very specifically, you don't have a U-listed waste or a P-listed waste unless you have a virgin product and it's the sole active ingredient. If it's not one of those two things, then it might not be regulated at the federal level. Check your state and local listings, depending on what state you're in, if that material has a state-specific regulation, like oil may have in Massachusetts. Another department that frequently gets missed is biomedical engineering. These are the folks that generate quite a bit of the batteries and some of the universal waste generated in most healthcare institutions. These are very specific waste streams, and there's a huge opportunity for recycling here. And potentially some profits. There are some electronic scrap dealers and scrap metal components here that can generate a profit center from some of the material that biomedical engineering generates. Some of the issues with collecting waste in biomedical engineering is the improper collection and storage of waste batteries. These batteries all have terminals. You guys have seen them before. Some of the lead-acid battery terminals are more specific to C. Lead-acid batteries will be all throughout your facility and pieces of machinery and equipment and backup lighting in the hallways. And when you touch those terminals together, there's the risk for sparks and for fires to collect in waste containers, in drums, or in departments. So it's important to tape those terminals, one, from a safety perspective, but two, you can't ship them off-site without taping those terminals per the Department of Transportation. So biomedical engineering, a large generator of universal waste, very important to the RCRA requirements is in your facility. Now, you'll see these opportunity slides as we sort of roll through, and this is going to come to the end of our mini RCRA session, but just a couple of quick opportunities for you that are right in front of your face and in disguise. We call them managing the 90 and the 180-day clock, depending on what size generator you are, whether you're a small or a large quantity generator. And then what we call a lab pack and process. Think about when you have an oldest bottle in your waste stream and you ship waste every 90 days if you're a large quantity generator. You don't necessarily have to do that because each bottle is regulated by itself. It's not always about what the oldest chemical is, and you don't necessarily have to get rid of every item in your main accumulation area if there's only one or two old bottles. Just get rid of all those old bottles. So you can save quite a bit of money over the life cycle of the year and in your budget cycles by managing those waste streams on a container-by-container basis. So if you have one bottle of waste sodium hydroxide, you have 90 days as a large quantity generator to generate more than one bottle of sodium hydroxide. So for those of you who are shipping smaller waste streams like a 5-gallon pail, instead of shipping multiple 5-gallon pails out during the course of the year, it might be an opportunity for you to generate one 5-gallon pail over the course of your life cycle, depending on what size generator you are. Some of those things have to go up by themselves, and that's unfortunate, but it's a requirement for the DOT. So maintain your oldest dates and ship in the most appropriate size containers. And in a lot of cases, we see a 15 to 20% cost reduction just by managing that clock so that you don't have to necessarily send out everything and have large bills associated with your waste shipments, 2 or 4 times a year. Use your generator size to your advantage. As we move into sort of a subset of hazardous waste, being universal waste, I'd just like to take a second and explain how something is a universal waste. So in stark contrast to some other things, you have to have once been a hazardous waste to technically be considered a universal waste. So we talk about things that have been deregulated. As we sort of get into the universal waste components, we see a lot of batteries like we talked about. Pesticides. Pesticides will not only fall under the universal waste standard under RCRA, but they will also follow up under FIFRA, F-I-F-R-A, the Federal Insecticide, Fungicide, and Rodenticide Act. These are all the things that come out of your buildings and grounds components that have to do with lawn care and lawn maintenance. Some of you may do that in-house. Some of you may outsource that to a vendor. If you have any of this material on site, they'll be regulated both under the Universal Waste Act and the FIFRA component. As much as we'd like to believe that we're mercury-free, healthcare is still not mercury-free. We see a lot of sphygmomanometers and switches from the boiler plant still left, and of course light bulbs. different light bulbs for different components. We see a lot of straight light bulbs, U-tubes, circulars, and what people tend to forget about the most are their parking lots and their HID bulbs, or high intensity discharge. These are typically very large, sometimes a foot or two in length, 6 to 8 inches in diameter. They take up a lot of room, and when they break, they're no longer universal waste, they're hazardous waste. So it's very easy to break these large light bulbs because they're delicate items, and proper storage of these items will save quite a bit of money when it comes from managing your universal waste over the life cycle of a year versus your hazardous waste, which is either a 90 or 180-day mix, depending on your generator status. Some opportunities, as we see this opportunity slide, most people get billed either by the pound or by the drum. If you get billed by the drum, obviously one of the opportunities is to maximize what's going into that drum. Now, we don't want to overfill some of these containers because they all have weight limits and batteries can be heavy. But an opportunity to save some dollars comes by managing waste streams by the drum. There are advantages on some levels to have some of your smaller waste streams, specifically for batteries, managed by the pound, because you don't want to pay for an entire drum worth of storage for just a few pounds of lithium batteries, let's say. Those little tiny button cell batteries that use lithium metals as the energy source. So some of your smaller waste streams in relationship to batteries can be managed by the pound. Specifically, what containers have you been shipping in? There are requirements for certain things. Will it be metal or steel or poly or a fiber container? There are some opportunities to reduce some of those costs and utilize reconditioned containers. They usually cost a little bit less. And ultimately, the streamlining of your disposal or your recycling vendors with folks that also ship your hazardous waste. We see a lot of this. We see a lot of separate universal waste vendors, and avoiding some of those additional pickup fees or schedule and delivery fees might be an opportunity for you to consolidate, spend less time with multiple vendors, and ultimately drive some efficiencies in your universal waste program. And then an opportunity we see a lot as one of the most cited things in the universal waste world is not storing your light bulbs appropriately, and they ultimately break. One of the most specific finds that we see is related to light bulbs and light bulb storage so that they are intact and can be managed as universal waste. Once they break, they become hazardous waste. So maximizing that light bulb storage either in the existing containers that they've come in, if you can maintain those, or buying a bulb drum with the correct lids and the labeling, save money over time. Topic near and dear to my heart. Fortunately or unfortunately, I'm also our Pharmaceutical Waste Management Director. This is something that's been gone on for almost as long as I've been working here in the industry. It's still a very hot topic, depending on what state you live in. The Northeast is still very hot to trot on pharmaceutical waste programs. Usually today we see folks revisiting existing programs, and we see very few that still don't have a program. Just want to remind everybody that pharmaceutical waste is regulated under RCRA, which is a hazardous waste standard. It's not regulated under your medical waste component, and it's not regulated in any other way. Pharmaceutical waste falls under RCRA unless your state also manages it at the state level. States like New Jersey and Florida do things a little bit differently and require some additional waste collection. So how this section of the program is going to go is I've broken down 8 core steps that we believe are key and critical to building any pharmaceutical waste management program. Each of those 8 steps are driven by 3 key compartments, the first being the fact-finding mission. Now, it's to your advantage to use the rules to your advantage so that you can identify some of those state and local differences. But part of the fact-finding mission is really understanding how big you are and what state you're in and what exemptions you can take advantage of. If you're a small quantity generator and you have a lot of P-listed waste, acutely toxic waste, you're only allowed to generate 2.2 pounds of that particular P-listed waste per calendar month. Now, if you're on the border and you think by building a pharmaceutical program it's going to force you into that large quantity generator status, it might make a whole lot of sense to build your program as an LQG right from the start. You can generate less waste containers, you can purchase less supplies. There are some additional responsibilities by being a large quantity generator, but what you'll find is you can basically have a virtual one-bucket program nowadays. There are some specific material that's chemically incompatible and they can't go together, but they're very few and far between. The major component to any fact-finding mission in the pharmaceutical waste world is performing what the industry has come to call a formulary characterization. A formulary is specific to the pharmacy department, and it's really like an inventory. Think of what pharmacy has the ability to purchase on any given day is something that's on their formulary. Spend time doing a waste characterization on those items on formulary, and don't forget some things that could be considered off of formulary or non-formulary items. And these things would be things that ultimately are purchased by some other department in the hospital. Sometimes radiology will buy their barium sulfate solutions themselves, or materials management will buy specific items for wound care or other departments. But performing this waste characterization, just like every other waste characterization you're required to do on every waste stream, is not only required, but it'll help you get to the next steps and the operational component of how am I actually going to collect this material. The last component to the fact-finding mission is really related to reverse distribution. I haven't come across a pharmacy yet that doesn't use a reverse distributor. And for those folks that don't understand what reverse distribution is, it's basically receiving a monetary credit for something that you'll no longer be using at your facility. Some of those are non-expired items. Some of those actually can be expired items. And they go back to the manufacturer through a middleman, and the hospital will receive financial credit towards it. The EPA is very clear on what you can and can't use reverse distribution for. And what you're not allowed to do is you're not allowed to use a reverse distributor as a form of hazardous waste disposal. There's no paperwork, there's no manifest, there's no land disposal restriction notification. But ultimately, using a reverse distributor for what it's required for the material that you're getting credit for, and that's the difference, what you're getting credit for versus what you're not getting credit for. If you've received credit, then the waste never falls under RCRA, it never falls into the hazardous waste category, and you can continue to send it back and get credit. If it's something that is disposed of or something you're not receiving credit for, that's the material, if it meets the definition of hazardous waste, that you want to consider collecting for hazardous waste disposal. You'll actually find some cost savings on the reverse distribution side of the house, because most folks bill you the cost of the disposal of the medication, not necessarily what traditional disposal costs could be. And we all know medication can be very expensive. The operational component, as we walk through this pharmaceutical waste program, is identifying where you're going to collect waste, and we call those satellite accumulation areas. These can be located in nursing units, on the floors, soiled utility rooms, medication rooms. You want to walk the facility and understand not only where these can be located, but where they should be located from a security standpoint. You want ease of access for all those involved for collecting waste. And there are some regulatory requirements that fall under these worlds, labeling and signage, and ultimately keeping container lids shut when they're not being added to. Now, one of the differences here is finalizing your waste streams. And this will be different for large quantity generators versus small quantity generators. Like we talked a little bit about, P-listed waste, 2.2 pounds per calendar month, is not a whole lot. And if you're a small quantity generator, you're required to prove that you're actually generating either that or less. And the only way to do that is really to collect it separately. Now, some states, Massachusetts included, have sort of unwritten rules related to how they ultimately portray how you generate that P-listed waste. So there are some components of leeway there. But finalizing those waste streams into either a virtual one-bucket program if you're a large quantity generator, again, making sure that any incompatible items are stored separately. Things like virgin and unused silver nitrate sticks, they're oxidizers, they react with things that are organic, so you can't put them together. And everybody has a cyanide antidote kit, if any pharmacists are listening. We don't use these a whole lot, and ultimately they expire usually every 4 years. These are both organic and inorganic oxidizers, and they have to be separated as appropriate. So finalizing your waste stream is important to understand what your total waste program is going to look like. And then ultimately, what's very important is the containers that you choose. Make sure you choose a DOT shippable container. What you want to avoid is shipping containers inside of other containers just to get them off your site because they're not DOT shippable. You spend quite a bit of money on overpacking containers when all you really need to do is ship these out either individually or palletized because they are DOT shippable containers. Many types of them in the industry. There's a picture here of one of them made by Covidian. Great products. Some people, have the ability to store more than others, but choosing a container is very important when you're building out your program. As we sort of wrap up pharmaceutical waste, the most important in my eyes program component of pharmaceutical waste management is the education and training of your staff. Now, most folks spend a lot of their time in nursing, environmental services, and pharmacy. And that's going to cover about 90% of the material and the folks that you need to have trained. This is where I would spend my money personally on the education, because it's going to come back tenfold when these folks are actually collecting waste. We want to make sure they're collecting the right material. We want to make sure they have the proper collection techniques. We want to make sure that they avoid collecting things that are not required or things that ultimately shouldn't be collected for one reason or another. This is where we recommend spending most of your time. And anything that you can do as a bonus education component. A lot of pharmacy has the ability to program Pyxis machines and OmniCell machines and Maytech units to help flag items that need to be disposed of as hazardous waste when they get pulled out of those units up on the floor. So something more extreme like that, or something very simple like color-coded systems that come from pharmacy or from other departments, can help follow that particular item through its life cycle and ultimately be collected in the correct container. Here's our opportunity slide again, specific to pharmaceutical waste. We want to make sure this DOT shippable component sticks. People save quite a bit of money on not spending money on supplies or overpack containers for those DOT shippable things. Really want to hammer down that education means generating the correct waste for your facility and your institution, regardless of what your generation is. Automate what you can. Take the human factor out of it. Make pre-printed labels, custom signage, things like that. And ultimately, where you can, make sure you understand what size generator that you will be when rolling out this program in its entirety. Because if you think you're going to be a large quantity generator at all, it might make sense to build that program as an LQG as opposed to a small quantity generator. And ultimately, nursing education is going to be your best friends when it comes to rolling out your program, because they know their staff, which is typically the largest in any institution, in regard to the training and education that they need to receive. That training is a yearly requirement under RCRA, general awareness style, general awareness level, and ultimately new hires have to have that training within the first 6 months of their employment. As we finish up pharmaceutical waste and sort of RCRA in general, the Research Conservation and Recovery Act issues a gravity-based matrix for civil penalties, and it's a grid. On the left-hand side, we see the potential for harm. So the more harm it could do, the more the fine. And to the extent of the deviation from the requirement, moving from right to left is where the fines increase also. So a labeling issue might be something that we see in the bottom right-hand side of this, something that's very habitual and consistent throughout an entire program. Not having a program makes its way into the upper left-hand side, just as a component from an example standpoint. Most fines are negotiated, so you typically don't see what you start with, ultimately what you end with. And sometimes there are what are called supplemental environmental programs that you can substitute in conjunction with a monetary fine to build programs that best support your institutions and your communities and your networks. Fines spend a lot of the regulators' time, and ultimately, a colleague of mine used to say, "Follow the buck. Where the money is, they will go." As we get into the last waste stream spotlight that we're talking about, medical waste. This is an ever-growing opportunity for waste reduction and diversion. And believe it or not, about 90% of all waste in the medical waste world is actually not RMW. Imagine if you could generate 50% less RMW because people were putting the right containers, putting the right waste streams in the right containers. It would save quite a bit on your overall budget. Medical waste is one of the largest volumes as compared to hazardous, universal, and pharmaceutical waste, and ultimately have a huge opportunity for upsides. Now, depending on what state you're in, there will be different names. If you're in New York listening today, we call it regulated medical waste. I spent 5 years in our New York office, and it's very different than some of these other states that title it infectious waste or even biomedical waste. Maine, if there are any Maine folks, biomedical waste is very particular in the language. There are several treatment standards for medical waste. We think of these treatment standards in, for the most part, 4 major waste streams. Red bag or just infectious waste. We think of sharps, We think of trace chemotherapy items, and we think of pathological waste. Now, when we think of trace chemotherapy waste, there's an opportunity for people to have a discrepancy here. A lot of times, trace chemotherapy waste is managed under the medical waste program, which technically it falls under, but this is a little bit of a gray area between RCRA and trace chemotherapy. So you actually have the ability to do both. You could manage your trace chemotherapy under RCRA and your pharmaceutical waste program if it made more sense to you in your institution, or keep it under the medical waste treatment. Some of the mechanisms here that we see as a treatment standard fall under the following categories. Incineration being that choice for a lot of the trace chemotherapy and pathological material. Autoclave is the largest by treatment standard by many states. A lot of the sharps waste makes their way to autoclave and ultimately to landfill. And most recently, Triumvirate has implemented a new recycling program for medical waste. We actually take the both red bag waste and sharps waste and turn it into a usable form of plastic, which people can get recycling credits for and ultimately reduce their budget significantly from a waste diversion standpoint. So check that out if recycling is on the top of your radar screen, with medical waste being one of the largest waste streams your institution generates. Here are some general terms. Now, just as a caveat here, each state, for the most part, manages their own medical waste program, and some of these terms are different state by state, just like the names were, biomedical waste versus infectious waste or regulated medical waste. There are 2 slides here. So these are not state-specific slides, and I'm going to spend some time talking about the different departments that generate these. So specific to pathological waste, we see a lot of this, as the name says, come from pathology or gross pathology. These tissues are usually fixed, and ultimately many states require the incineration of these. Massachusetts is one of those. New York doesn't necessarily require it. They use it as a best management practice, and it's about a 75-25% split between the states all across the country as to who require incin versus those that don't. Human blood and blood products, a lot of this material ends up going down the drain, which in many states is allowed. Cultures and stocks, we see a lot of this stuff come from not only hematology and microbiology, but research laboratories. A lot of medical waste in research laboratories, and not only healthcare, but folks that are in the life sciences arena, and ultimately folks that work in biotech. We see a lot of cultures and stocks from those waste streams. Sharps, we're no stranger to sharps. We get to the point where these are folks that do the pickups almost on a daily basis, and there's quite a bit of waste stream that gets generated from here. We see both reusable and disposable containers. There's arguments for either. And ultimately, this is a very high-touch waste stream for needle stick injuries, and not just specific to needle sticks, but also in laboratory sessions and ultimately within research areas. Not just specifically syringes or needles, but also plastic pointy objects, plastic pipettes, and broken glass are considered sharps under the medical waste standards. I'm not going to mention a whole lot on isolation waste, but it's something we've heard a lot about recently with the Ebola scare. And this is a prime example of waste generated in isolation. There are others, there are plenty of others, but this being the most recent and up front in our face. And then last but not least, we see animal carcasses, body parts, and bedding related to a lot of those animal facilities that we may or may not have in our institutions if we do any animal research. As we finish up the medical waste, some of the opportunities that derive themselves there are making sure that your containers have the minimal amount of touches as possible. So if there's an opportunity to ship the waste in the same container that you generated in, infection control, I'm sure, would love you very much. Multi-touch containers are a reality, and we have to utilize them, but there's opportunities here for reduction. Storage space is key. The more you can ship at a given time will streamline your waste shipments. There's an argument, like we talked about, between reusable and disposable containers. In a lot of cases, it might be a wash depending on how much disposable containers you go through, but the reusable market is great from a sustainability component. My apologies. And then recycling. We here at Triumvirate are very forthcoming with building recycling programs and building best-in-class, world-renowned institutions. So if anybody is interested in the medical waste recycling components, please feel free to reach out to any of us after the webinar. We'll be happy to answer any of your questions. So in summary, we talked a little bit about the regulators, we talked a little bit about where their focus was. We spent some time in these 4 arenas, and this is a lot of the waste that gets generated in healthcare, and all of it that's regulated. The biggest difference is we have these opportunities, but with opportunities come a lot of challenges. Not having a plan is the biggest one. We see a lot of people with the inability to assess, really the complete data for their total spend. They don't have any idea what they actually spend. Getting a really good understanding of where the money is spent and what it's spent on is really, it's part of the plan. It's part of the development of your program. They don't know where programs begin or end. That's extremely important too, to understand where your budgets begin and end. Not only just from a fiscal component and when they start and end on the calendar, but whose departments are in charge of what waste streams, and is there an opportunity there? Most folks don't link waste management costs to what we call key performance indicators or key performance metrics. These are things like patient days and adjusted patient days. Why not measure, waste generation in the way that the hospital understands, not just, some of the folks in our environmental health and safety departments or our environmental services departments, but if you generated X amount of waste per patient day, or if you generated X amount of waste per your adjusted patient day, it might make a little bit more sense to those folks all throughout the institution, so that it's a relevant internal metric. And then service providers are typically motivated to increase waste, not decrease it. We tend to spend a lot of time on the recycling component end, so align your goals with your waste management providers, and you'll have a little bit less on the challenge side of the house. Just to recap, with the right methodology, education, and resources, healthcare can improve its waste management plan, where the annual savings really could pay for 1 out of every 4 years. We've seen this time and time again in some of these institutions that spent a lot of time on their plan and their programs, and this was the goal of the presentation, is to make sure that folks can dive into their waste streams and then zoom back out to the larger picture, and ultimately develop an action plan. An action plan which, in my mind, should include these 3 major components. Perform that gap analysis, understand where you are and where you need to be of your program, and point out the weak points. It's okay to have weak points in a program. There are a lot of great resources out there, Triumvirate included. Please feel free to reach out to us if you need help with building your action plan. Data, data, data. It's all about data. Being able to provide accurate, real-time data helps everybody make decisions much, much faster. Wouldn't it be nice if, instead of waiting till the end of every month to determine how you did, to know where you are every single day? Utilizing that plan and gap analysis to track the data that you want to track is a key component of this action plan, and one that I would highly recommend using as a key performance indicator as often as possible. With that, I've sort of said a lot in relationship to very much of the regulated waste stream, so I will turn it back over to our moderator, Sasha, and field any questions that anybody has, and ultimately, if we don't get to some of them, we will make sure that we follow up with everybody individually. Thank you very much for your time, and I look forward to your questions.
All right, guys, so like Steve said, we're opening it up for questions. Anybody who wants to ask a question can type them into the questions pane on the right side of their screen. So feel free to do that. We have our first question is about pharma. Someone wants to know, they saw the pie chart that you included, and they said that pharma only represents 1%. Why should they even really care about it? What's the point of focusing on pharma?
Yeah, no, that's a great question. Pharmaceutical waste does represent a very, very small percentage of the total waste volume. Now, understanding that it's such a small percentage of the total waste volume, you really have to understand that most of the fines in the last 3 to 5 years has been on pharmaceutical waste. So it's a huge opportunity in disguise. You can take that tiny little waste stream and make sure that you're managing it as efficiently as possible so that your waste budgets come down. So being a regulator focus and being very specifically one of the drivers of fines and citations over the last half-decade is probably one of the biggest driving components of making sure that that small waste stream is managed appropriately. And the other reason is it touches more people in your institution than a lot of your other programs do. most of these other programs are focused department by department, where pharmaceutical waste is across all the clinical and non-clinical practices of nursing and pharmacy and the doctors and all the different departments, whether it be high-risk areas like the OR, the ED, the PACU. Very, very important to maintain that level of compliance in a program that's such high priority throughout the institution. I hope that answers your question. There are a million and one reasons to build a great pharmaceutical program. Those are just a couple.
Great. Next question. I was under the impression that alcohol was not required to collect as a hazardous waste. My local POTW has even given me a letter stating it is okay to drain dispose of alcohol waste. Is the alcohol waste that is generated from my laboratory regulated as a hazardous waste, and are we required to collect that material?
Yeah, no, definitely a great question. We get this a lot, and we typically get this from small to mid-sized healthcare outside of big cities. So, within a pretty good radius of a major city, like outside of Boston or New York. But specifically, do you have to collect your alcohols? The answer is yes. The EPA, under federal law, under RCRA, regulates that all ignitable material, and they define ignitable being having a flash point of less than 140 degrees Fahrenheit, be collected for hazardous waste disposal. Now, there are some exceptions. There's the 24% alcohol exemption. So if you have an alcohol that's less than 24%, then you might be exempt from that material. The alcohols that we see in laboratory, which is the primary driver of alcohols for waste collection throughout an institution in healthcare, is nowhere near the 24% exemption. They're all in the 95 to 100% range, and will obviously not apply to things that are not specifically alcohols. So when we talk about alcohols and alcohol exemptions and opportunities not to collect, we're thinking of things like isopropanol, ethanol. There's not very many of them. Healthcare will generate xylene and other ignitable solvents as a component with their ignitable alcohols. So make sure you definitely collect those alcohols, and even if you have a letter from your locals, your publicly owned treatment works, they like those alcohols for different reasons, and ultimately you have to always comply with the more strict regulation. And in this case, the more strict regulation falls under the federal RCRA regulations related to ignitability.
Great, thanks. Very helpful. So it looks like a few of you have raised your hands in the attendees bar. So just so you know, no need to raise your hand. I'm fielding all the questions. So if you just want to directly ask in the questions pane, that's great. So I have one more question lined up. So we will have a little bit more time to answer any extra questions. If anybody has another question, I'd be happy to answer it. So next question. At my hospital, we use only green-tipped light bulbs. We have been told that these bulbs are not considered universal waste and they can go into the trash. Is this correct?
Great question. Again, another one that we get a lot. The industry is shifting. We see a lot of green-tip bulbs depending on your institution and your abilities to purchase. You may or may not have some of those. All the green-tip bulb means is there's less mercury vapor inside that light bulb. There are 1,000,001 studies out there that show that not all the time does it fall below the regulated levels. And if you were to run a split, it's about 75% of the material. All light bulbs are not created equal. So if you have 100 of those light bulbs, all the same make, model, manufacturer, 75% of them, according to the studies, will actually still trip what's called the TCLP value, or T-clip, for mercury. Now, all the metals, RCRA metals, are regulated. Mercury is one of them. In this particular case, it's the mercury vapor inside the light bulb. There are very few that analytical has been run that come out of that hazardous waste category. The trick is knowing which ones are which, because you're not really going to do analytical on every single light bulb before you dispose of them. So yes, you are required to collect light bulbs as a universal waste requirement. If you have green-tipped light bulbs, you have a couple of options. You can either comply with the more strict standards and collect that material for waste disposal, in this case recycling, or you can perform analytical and perform that within a reasonable time frame, and continue to do that so that the regulators have proof that you've done some due diligence to understand what you're required to collect and what you're not required to collect. I hope that answers your question. It's a tricky subject because a lot of the manufacturers will push that these have less mercury in them and that they may not be regulated the same way, and they're absolutely true, but there are some sticking points related to the levels that you'll see in those light bulbs of mercury vapor.
Great. I have a few more questions in the queue. Someone wants to know if you could tell us a little bit more about collecting controlled substances under the pharma waste arena.
Yeah, sure. Narcotics are becoming a very, very hot topic again for a couple of different reasons. One of them being the diversion of those narcotics. When you think about hazardous waste and hazardous waste pharmaceutical programs, it's a window. It's a very small window of what you're required to do. There is a couple of narcotics that we think about when we're looking at RCRA-regulated narcotics, and probably one of the most common ones that we see is chlorohydrate. Chlorohydrate is a Youll-listed hazardous pharmaceutical waste that also meets the definition of a narcotic. So in the event that you had something that was both a RCRA-regulated narcotic and something that fell into one of the schedules of narcotic drugs, you would be required to collect that if and when you had any material left over that still met the definition of that particular type of hazardous waste. And just to follow up on the example of chlorohydrate, chlorohydrate that's been spent for its intended purpose and RCRA empty, which is less than 3% of the total liquid volume of the container, falls out of that category. So we see people collect very little hazardous narcotic waste. One, because chlorohydrate is sort of gone by the wayside, not everybody generates it, and ultimately because this material gets used and is spent for its intended purpose and doesn't fall into the hazardous waste characteristic of the U34 code for chlorohydrate. There have been some recent additions via the DEA to help hospitals in particular become generators of waste narcotics from patients so that their community can bring narcotics to them. There is some registration requirements and definitely maybe another webinar, but this is a great big topic to get some narcotics off the street and to get them into a place where they can be managed appropriately.
Great. I can have time for one more question that I'll ask, but if anybody else has more questions, feel free to type them into your questions pane and we'll answer them after the webinar. So last question, someone asked if you could tell a little bit more about how RMW can be converted to a plastic product.
It's an exciting process. So just to back up for 2 seconds, we've been looking over the last 5 or 6 years of how better to handle some of the largest streams in healthcare. One of that being solid waste, and solid waste recycling has absolutely taken off. Another being medical waste. And as part of medical waste, believe it or not, based on our studies, about 78% of all the material that goes in red bag waste and in sharps waste, it's actually plastic already. So we have a unique process out at one of our facilities where there's a source separation component where we take the hodgepodge of things that end up in those waste containers, which, as you understand, is quite a lot, and ultimately source separate them. I sort of think of it as like a brewmaster. You want to pull all that stuff apart in its component pieces and put it together in the right components so that we can make what's called a low grade industrial plastic that gets used for industrial forms and things like that. So when I say that we make a plastic, we make a real live plastic product that gets sold on the back end, so we can offset some of the disposal costs and share those cost savings with our customers that ultimately get to tout their medical waste programs as material for recycling. So there's a lot of specifics and nuances in the actual plasticization process and the source separation process. You can think of a lot of grinders and shakers and magnetics and things like that do source separate, but it's about taking all the components apart and putting them back together again in the right format so that we can produce what is ultimately a low-grade plastic product for use.
Great.
If you have any other questions, I'd be happy to follow up with you individually. There's just a lot to it.
Awesome. So it looks like we're out of time. I just want to thank everybody for their questions. And let you know that we'll send you an email with a copy of the presentation along with a recording later today. The email will also have a link to a survey asking you to rate this webinar. If you could please fill it out, that would be very helpful to our team here at Triumvirate in working to improve future webinars. We have several upcoming webinars, including one on best preventative maintenance practices at your facility. You can find these events on our events page at the link www.triumvirate.com/training/events. I will also send you that link, no need to memorize. Also, we recently came out with a waste minimization blueprint specifically for the healthcare industry. This is a custom checklist designed to help you save money and meet sustainability goals through waste minimization. The link is the info.triumvirate one at the end of the page, but I will send you a link as well via email. Also, keep an eye out for a special offer from us at Triumvirate for attending this webinar. Thank you guys for your time. It was fun. Bye.
Thank you, everybody. Appreciate your time.